If you have pelvic organ prolapse, what symptoms might you have? I'm the Kegel Queen. I'm a registered nurse, and my name is Alice Adams. In this video, I'm here to talk with you about what you might experience if you have a cystocele or prolapsed bladder, a rectocele or prolapsed rectum, or a prolapsed uterus. Some women may have very mild prolapse and not have any symptoms at all. And for some women, the prolapse is so severe that it can really limit your ability to function normally in your daily life. What happens is if you find a bulge yourself, or sometimes a doctor or healthcare provider will find a bulge when doing a pelvic exam. That's kind of the defining thing about it, is that there's this bulge in your vagina. If you have a cystocele, a prolapsed bladder, that bulge is at the front of the vagina. If you have a rectocele, a prolapsed rectum, that's at the back wall of the vagina. And then if your uterus is prolapsed, you just feel the tip of the uterus, the cervix, lower down in the vagina than it ought to be. Sometimes, if a prolapse is mild, sometimes it's actually not unusual for a healthcare provider to notice the prolapse and not mention it. And that's because they're unaware of things you could be doing to help prevent your prolapse from getting worse. They're just uninformed, so they think, unless it's bad, why should I even mention it? It's so common, it's not affecting her, why should I mention it? So unfortunately, sometimes you might not know, even if you do have one. If you have prolapse and it's really severe, again, either the bulge from the bladder or the rectum covered by the vaginal wall could be protruding out from the vaginal opening at worst. Likewise, a very severe prolapse with the uterus could have the cervix poking out of the vaginal opening. That's when it's really severe. With various degrees of prolapse, you can have sensations of heaviness, aching, pressure. You may feel a feeling of fullness in your vagina. Some women describe it as a dragging sensation, or say it feels like they're sitting on something. You might have pain in your belly or your back. You might have difficulty emptying your bladder or moving your bowels. And pelvic organ prolapse, whichever type it is, can interfere with sex, especially if you or your partner are afraid about it and you don't know how to handle that issue. The good news is that sex is actually okay with prolapse. You don't have to stop having sex, and in fact, you can still have really great sex in spite of prolapse. You just need to know a few things about how to be careful, and it's really not a big deal. The main thing is to not be afraid about it. To find out more about pelvic organ prolapse and what you can do about it, please go to kegelqueen.com. I'm the Kegel Queen, and I'm here to help.